doctor is in, you know, it's so easy to get nervous and not make the most out of your doctor visits. But our next guest has tips to help you create that important bond with your doctor. Joining us now is Dr. Ken Redcross, who is the author of Bond, the 4 Cornerstones of a Lasting and Caring Relationship with Your Doctor. Welcome back to Bloom.
Oh, thank you so much, Gail. It's wonderful to be back with you and everyone out there watching.
Oh, and we always love catching up with you. And in your book, you say that people can have a lasting and caring relationship with their doctors. But for some, this might seem far-fetched. What would you say to those folks?
You know, I know it seems far-fetched, and it feels that way, everyone. When you're looking at how long the appointments are, they're averaging 15 minutes. And actually, when you look at the studies, it's about 7.5 minutes, Gail. So I get it. But you're right. That's why I figured that it was important to try to get some tips so that we can maximize that doctor's visit each and every time we see our docs.
Yeah, you know, I have a great doctor, and even though our appointments aren't that long, I do feel like they might as well be an hour. We cram so much into that time period. So I guess that's what folks need to know, like to come in, you know, ready for that meeting. What can we do to start creating the bond?
So I'll tell you, Gail, so you're one of the few that's really blessed with that good relationship with your doctor. So I congratulate your doctor for making that bond. But I'll tell you, for the other ones out there who are trying to figure it out, number one, think about it as a strategic visit. Don't just go into the doctor's office as just something to do. No, this is your health. So the first thing I want you to do before you go is you need to make a list. How many times do you get to the doctor's office and the next thing you know, you leave the office and you're like, oh, I forgot to ask the doctor this, and good luck trying to call back in and get your question answered. It's going to be a big challenge once you're finally out of there. The second thing I always say is repeat the information. The reason why I say that, Gail, is your retention is different. You're in the office. Sometimes you're thinking of something else. You're nervous. You're scared. And when they do these studies, they recognize that we only remember really about 20% of what the doctor said, and the studies went deeper to show that half of that is incorrect. So you want to make sure you're repeating that to kind of help with your retention. And last but not least, this goes back to when we were in grade school. Ask questions. This is about your health. Look, we're your physician, but we're not above. We're eye to eye. We're partners in all of this. So if there's something that the doc is saying that doesn't make sense or something that you need a little more clarification on, you have to ask questions. Once again, this is a sharing back and forth. So those 3 tips are important to make sure that this is a proactive, strategic visit that leads to high-yield outcomes.
You know, another thing that I was thinking about is that when you're with your doctor and you have questions asked, sometimes there's subjects that are seemingly so sensitive that you're almost embarrassed to bring it up with your doctor. Yeah. Like, what would be your top 3 most difficult discussions to have with your doc?
You know, Gail, that's a fabulous question, actually. Look, you know, one of the things is I'm a Western-trained physician, everyone. I trained in Columbia here in New York City. And, you know, I've had to kind of put on my Eastern medicine hat a little bit because you all have heard the story of vitamin D through this pandemic, which has really almost been 2 years now because we know that vitamin D is so important for our immune health. So some patients felt a little weird to talk about that until they recognized that they were preachers to the converted. I already knew about the benefits of vitamin D and getting your levels and making sure they're between 40 and 60. Once again, it's an immune system story. So don't be bashful about talking to your doctor, whether it be about vitamin D or other supplements that can really kind of boost how you're doing and your immune system. The other thing that patients were a little bit reticent to talk about was obviously the vaccines. Look, the vaccines are back and forth as far as how you feel about them, whether they're for you. One of the things that I think is so important, and from us in the medical community, I think we need to tell all of you is why the vaccine is good for you, right? It's different when there's this stuff coming all around. That kind of pushes people away sometimes, Gail, who have different feelings. I need to explain. You have heart failure, you have diabetes, you're perfect for this. Or my 17-year-old who's out and about, wears their mask and they're good, and they're like, Doc, I don't know. We don't speak the same language at that point, so I have to change. The third thing I recognize, which is really difficult to talk about right there with vitamin D and supplements actually, is coming clean. During the pandemic, unfortunately, we have learned that there were a lot of bad habits picked up when we were closed up for the past 18 months. And I get it. People were drinking more. People went back to smoking. People really have to feel comfortable with their doctor, Gail, to come clean. And the coming clean part is what was so difficult for people. And still, it's just kind of learning more of what's really coming out of the coronavirus story.
Well, I have to tell you, this has been such a helpful conversation, and since the last time we talked, I will tell you, I have been taking my vitamin D and checking my vitamin D levels, so thank you so much for that incredible advice, Doctor.
Oh. Well, thank you for sharing that. And it's so important, everyone, to kind of marry that Western medicine with some of the things that we're learning in our community.
Absolutely.
So vitamin D needs to be a part no matter what.
All right. Thank you, Dr. Redcross. And for more information, you can visit drkenredcross.com and powerofd.org. We'll be back with more Bloom right after this.